Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. These are NCLEX practice questions. Without delay, let's get started.
A client with Berger's disease has established a goal to stop smoking. Which medication would be the most helpful in attaining this goal? 1. Bupropion. 2. Nicotine. 3. Nitroglycerin. 4. Ibuprofen. The correct answer is 1. Bupropion is used to promote smoking cessation. All types of nicotine should be avoided to prevent vasoconstriction. Nitroglycerin, used for angina, and ibuprofen, an anti-inflammatory medication, have no role in smoking cessation. The primary goal for the client with Berger's disease is to prevent 1. Embolus formation, 2. Fat embolus formation, 3. Thrombus formation, 4. Thrombophlebitis. The correct answer is 3. Because of the inflammation, a common complication of Berger's disease is thrombus formation and potential occlusion of the vessel. Inflammation of the immediate and small arteries and veins is involved in the disease process. Embolus is a potential risk if a thrombus has developed. Fat embolus is associated with fractures of the bones. Thrombophlebitis occurs after thrombus formation. The client has had a below-the-knee amputation, secondary to arterial occlusive disease. The nurse is instructing the client in residual limb care, which of the following statements by the client indicates that the client understands how to implement the plan of care. 1. I should inspect the incision carefully when I change the dressing every other day. 2. I should wash the incision, dry it, and apply moisturizing lotion daily. 3. I should rewrap the stump as often as needed. 4. I should elevate the stump on pillows to decrease swelling. The correct answer is 3. The purpose of wrapping the residual limb is to shape the residual limb to accept a prosthesis and bear weight. The compression bandaging should be worn at all times for many weeks after surgery and should be reapplied as needed to keep it free of wrinkles and snug. The dressing should be changed daily to allow for inspection of the stump incision. No lotion should be applied to the stump unless specifically prescribed by the physician. The stump should not be elevated on pillows because this will contribute to the formation of flexion contractures. Contractures will prevent the client from wearing a prosthesis and ambulating. A client has undergone an amputation of 3 toes and a femoropopliteal bypass. The nurse should teach the client that after surgery, which of the following leg positions is contraindicated while sitting in a chair? 1. Crossing the legs. 2. Elevating the legs. 3. Flexing the ankles. 4. Extending the knees. The correct answer is 1. Leg crossing is contraindicated because it causes adduction of the hips and decreases the flow of blood into the lower extremities. This may result in increased pressure in the graft in the affected leg. Elevating the legs, flexing the ankles, and extending the knees are not necessarily contraindicated. While the nurse is providing preoperative teaching for a client with peripheral vascular disease who is to have a below-the-knee amputation, the client says, I hate the idea of being an invalid after they cut off my leg. The nurse's most therapeutic response should be, 1. You'll still have one good leg to use. 2. Tell me more about how you're feeling. 3. Let's finish the preoperative teaching. 4. You're fortunate to have a wife who can take care of you. The correct answer is 2. Encouraging the client who is undergoing amputation to verbalize feelings is the most therapeutic nursing intervention. By eliciting concerns, the nurse may be able to provide information to help the client cope. The nurse should avoid value-laden responses, such as, you'll still have one good leg, that may make the client feel guilty or hostile and block further communication. The nurse should not ignore the client's expressed concerns, nor should the nurse reinforce the client's concern about invalidism and dependency or assume that his wife is willing to care for him. A client with peripheral vascular disease is recovering from an aortofemoral popliteal bypass graft. When developing a postoperative education plan, which question by the nurse will provide the most helpful information? 1. How did you manage your health before admission? 2. How far could you walk without pain before surgery? 3. What is your home environment like? 4. Do you have problems with urine retention? The correct answer is 1. Assessing the individual's health behavior before surgery will help the nurse and client develop strategies to manage the postoperative course. Asking open-ended questions will elicit the most helpful information. The client's ability to walk after surgery will be improved after surgery. The nurse can ask direct questions after obtaining general information. A client with peripheral vascular disease, coronary artery disease, and chronic obstructive pulmonary disease takes theophylline 200 milligrams twice daily every day and digoxin 0.5 milligrams once a day. The physician now prescribes pentoxifylline. To prevent problematic adverse effects, the nurse should monitor the clients. 1. Digoxin level. 2. Partial thromboplastin time. 3. Serum cholesterol level. 4. Theophylline level. The correct answer is 4. Pentoxifylline can potentiate the effects of theophylline and increase the risk of theophylline toxicity. Therefore, the nurse should monitor the client's theophylline level. Pentoxifylline does not interact with digoxin. Pentoxifylline can interact with heparin, and the client's PTT would need to be monitored closely if the client were taking heparin. It does not affect cholesterol levels. The client with peripheral vascular disease has been prescribed diltiazem. The nurse should determine the effectiveness of this medication by assessing the client for 1. Relief of anxiety. 2. Sedation. 3. Vasoconstriction. 4. Vasodilation. The correct answer is 4. Diltiazem is a calcium channel blocker that blocks the influx of calcium into the cell. In this situation, the primary use of diltiazem is to promote vasodilation and prevent spasms of the arteries. As a result of the vasodilation, blood, oxygen, and nutrients can reach the muscle and tissues. Diltiazem is not an anti-anxiety agent and does not promote sedation. It also does not cause vasoconstriction, which would be contraindicated for a client with peripheral vascular disease. One goal in caring for a client with arterial occlusive disease is to promote vasodilation in the affected extremity. To achieve this goal, the nurse should encourage the client to 1. Avoid eating low-fat foods. 2. Elevate the legs above the heart. 3. Stop smoking. 4. Begin a jogging program. The correct answer is 3. Nicotine causes vasospasm and impedes blood flow. Stopping smoking is the most significant lifestyle change a client can make. The client should eat low-fat foods as part of a balanced diet. The legs should not be elevated above the heart because this will impede arterial flow. The legs should be in a slightly dependent position. Jogging is not necessary and probably is not possible for many clients with arterial occlusive disease. A rehabilitation program that includes daily walking is suggested. The nurse is instructing a client who is at risk for peripheral vascular disease how to use knee-length elastic stockings. The teaching plan should include which of the following? Select all that apply. 1. Apply the elastic stockings in the morning. 2. Remove the stockings if swelling occurs. 3. Apply the stockings while in bed. 4. Once the stockings have been pulled over the calf, roll the remaining stocking down to make a cuff. 5. Keep the stockings in place for 48 hours and reapply using a clean pair of stockings. The correct answers are 1 and 3. Elastic stockings are used to promote circulation by preventing pooling of blood in the feet and legs. The stocking should be applied in the morning before the client gets out of bed. The stocking should be applied smoothly to avoid wrinkles, but the top should not be rolled down to avoid constriction of circulation. The stocking should be removed every 8 hours, and the client should elevate the legs for 15 minutes and reapply the stockings. Clean stockings should be applied daily or as needed. A client who has been diagnosed with peripheral vascular disease is being discharged. The client needs further instruction if she says she will 1. Avoid heating pads. 2. Not cross the legs. 3. Wear leather shoes. 4. Use iodine on an injured site. The correct answer is 4. The client should avoid using iodine or over-the-counter medications. Iodine is a highly toxic solution. An individual who has known PVD should be seen by a physician for treatment to avoid infection. The client with PVD should avoid heating pads and crossing the legs and should wear leather shoes. A heating pad can cause injury, which, because of the decreased blood supply, can be difficult to heal. Crossing the legs can further impede blood flow. Leather shoes provide better protection. The nurse is planning care for elderly clients who are affected by orthostatic hypotension. The nurse should do which of the following? Select all that apply. 1. Assist the clients to stand to help prevent falls. 2. Teach clients how to gradually change their position. 3. Request a prescription for antihypertensive medications for clients at high risk. 4. Conduct fall risk assessments. 5. Consider the use of sequential compression devices for high-risk clients. 6. Place clients on bed rest. The correct answers are 1, 2, 4, and 5. Orthostatic hypotension is a drop in blood pressure that occurs when changing position, usually to a more upright position. Orthostatic hypotension often occurs in elderly clients, and it is a common cause of falls. Nurses must assess clients for orthostatic hypotension and assist all clients with orthostatic hypotension in standing to help prevent falls. Lower limb compression devices aid in prevention of decreased orthostatic systolic blood pressure and reduce symptoms in elderly clients with progressive orthostatic hypotension. Nurses must teach clients how to gradually change their position, and they must conduct fall risk assessments. Sequential compression devices may be helpful to high-risk clients and should be considered when developing the care plan. Antihypertensive medications are not necessary for clients with orthostatic hypertension and may precipitate dangerous drops in blood pressure. The client should be encouraged to be ambulatory. The nurse is tracking data on a group of clients with heart failure who have been discharged from the hospital and are being followed at a clinic. Which of the following data indicate that nursing interventions of monitoring and teaching have been effective? 1. 90% of clients have not gained weight. 2. 75% of the clients viewed the educational video. 3. 80% of the clients reported that they are taking their medications. 4. 5% of the clients required hospitalization in the last 90 days. The correct answer is 4. The goals of managing clients outside of the hospital are for the clients to maintain health and prevent readmission. Thus, interventions, such as monitoring and teaching, appear to have contributed to the low readmission rate in this group of clients. Although it is important that clients do not gain weight, view educational material, and continue to take their medication, the primary indicator of effectiveness of the program is the lack of rehospitalization. The nursing assistant reports to the nurse that a client is feeling short of breath. The client's blood pressure was 124/78 2 hours ago with a heart rate of 82. The nursing assistant reports that blood pressure is now 84/44 with a heart rate of 54, and the client stated, "I just don't feel good." Which of the following interventions should the nurse initiate? Select all that apply. 1. Confirm the client's vital signs and complete a quick assessment. 2. Inform the charge nurse of the change in condition and initiate the hospital's rapid/emergency response team. 3. Make a quick check on other assigned clients before spending the amount of time required to take care of this client. 4. Position client in semi-Fowler's position. 5. Stay with the client and reassure the client. 6. Call the physician and report the situation using SBAR format. The correct answers are 1, 2, 4, 5, and 6. The nurse must have assessment data and verify vital signs if necessary in order to determine the action that is required. If there is a significant change in the client's condition, the charge nurse should be notified in order to help the nurse with both this client and the nurse's other assigned clients if necessary. Most acute care facilities have a rapid response team that can also help assess and intervene with basic standing orders if necessary. Positioning the client in semi-Fowler's is a nursing action that may assist in breathing and relieve shortness of breath. It is important for the nurse to reassure the client by staying calm and remaining with client. The physician must be notified of the change in client's condition. The nurse must have all information available and present it to physician in a concise and accurate manner using SBAR format, including a recommendation for treatment if indicated. The nurse should stay with this client and delegate checking on other assigned clients to the charge nurse or nursing assistant. The nurse is caring for a client whose condition has been deteriorating. The client becomes unresponsive. The blood pressure is 80/40, and oxygen saturation is 90% on 50% face mask. The nurse should 1. Begin chest compressions. 2. Call the rapid response team. 3. Remove the family from the room. 4. Ventilate the client with a bag mask device. The correct answer is 2. The rapid response team should be called immediately to evaluate and treat the client. There is no indication at this time for manual ventilations or chest compressions. If the family is not interfering in client care, it can be reassuring to the family to see that all possible care is being provided. The monitor technician informs the nurse that the client has started having premature ventricular contractions every other beat, which is a priority nursing action. 1. Activate the rapid response team. 2. Assess the client's orientation and vital signs. 3. Call the physician. 4. Administer a bolus of lidocaine. The correct answer is 2. The priority action is to assess the client and determine whether the rhythm is life-threatening. More information, including vital signs, should be obtained, and the physician should be quickly notified. A bolus of lidocaine may be prescribed to treat this arrhythmia. This is not a code-type situation unless the client has been determined to be in a life-threatening situation. A nurse is helping a suspected choking victim. The nurse should perform the Heimlich maneuver when the victim 1. Starts to become cyanotic. 2. Cannot speak due to airway obstruction. 3. Can make only minimal vocal noises. 4. Is coughing vigorously. The correct answer is 2. The Heimlich maneuver should be administered only to a victim who cannot make any sounds due to airway obstruction. If the victim can whisper words or cough, some air exchange is occurring, and an emergency medical system should be called instead of attempting the Heimlich maneuver. Cyanosis may accompany or follow choking. However, the Heimlich maneuver should only be initiated when the victim cannot speak. During rescue breathing and cardiopulmonary resuscitation, the victim will exhale by 1. Normal relaxation of the chest. 2. Gentle pressure of the rescuer's hand on the upper chest. 3. The pressure of cardiac compressions. 4. Turning the head to the side. The correct answer is 1. The exhalation phase of ventilation is a passive activity that occurs during CPR as part of the normal relaxation of the victim's chest. No action by the rescuer is necessary. When performing external chest compressions on an adult during cardiopulmonary resuscitation, the rescuer should depress the sternum. 1. 0.5 inch. 2. 1 inch. 3. 1.5 inches. 4. 2 inches. The correct answer is 4. An adult sternum must be depressed 2 inches with each compression to ensure adequate heart compression. A client is given amiodarone in the emergency department for a dysrhythmia. Which of the following indicates the drug is having the desired effect? 1. The ventricular rate is increasing. 2. The absent pulse is now palpable. 3. The number of premature ventricular contractions is decreasing. 4. The fine ventricular fibrillation changes to coarse ventricular fibrillation. The correct answer is 3. Amiodarone is used for the treatment of premature ventricular contractions, ventricular tachycardia with a pulse, atrial fibrillation, and atrial flutter. Amiodarone is not used as initial therapy for a pulseless dysrhythmia. The nurse is preparing the client for cardioversion. The nurse should do which of the following? Select all that apply. 1. Explain the procedure to the client. 2. Place a self-adhesive patch between the skin and the paddles. 3. Place the paddles over the client's clothing. 4. Call clear before discharging the electrical current. 5. Record the delivered energy and the resulting rhythm. The correct answers are 1, 2, 4, and 5. The nurse should first explain the procedure to the client, and then place the patch electrodes per agency procedure. The nurse must make sure to call clear before discharging the electrical current to prevent injury to others who may be helping with the procedure. After the procedure, the nurse must record the amount of electrical current delivered and the resulting rhythm. The paddles are placed on the patch adhered to the client's skin, not over the client's clothing. Upon assessment of third-degree heart block on the monitor, the nurse should first 1. Call a code. 2. Begin cardiopulmonary resuscitation. 3. Have transcutaneous pacing. 4. Prepare for defibrillation. The correct answer is 3. Transcutaneous pads should be placed on the client with third-degree heart block. For a client who is symptomatic, transcutaneous pacing is the treatment of choice. The hemodynamic stability and pulse should be assessed prior to calling a code or initiating CPR. Defibrillation is performed for ventricular fibrillation or ventricular tachycardia with no pulse. The client, who had a permanent pacemaker implanted 2 days earlier, is being discharged from the hospital. The client understands the discharge plan when the client 1. Selects a low cholesterol diet to control coronary artery disease. 2. States a need for bed rest for 1 week after discharge. 3. Verbalizes safety precautions needed to prevent pacemaker malfunction. 4. Explains signs and symptoms of myocardial infarction. The correct answer is 3. Education is a major component of the discharge plan for a client with an artificial pacemaker. The client with a permanent pacemaker needs to be able to state specific information about safety precautions, such as to refrain from lifting more than 3 pounds or stretching and bending, and to count the pulse once per week that are necessary to maintain proper pacemaker function. The client will not necessarily be placed on a low cholesterol diet. The client should resume activities as he is able and does not need to remain on bed rest. The client should know signs and symptoms of MI, but is not at risk because of the pacemaker. A client is scheduled for the insertion of an implantable cardioverter defibrillator, ICD. The spouse expresses anxiety about what would happen if the device discharges during physical contact. The nurse should tell the spouse, 1. Physical contact should be avoided whenever possible. 2. They will not feel the countershock. 3. The shock will be felt, but it would not cause any harm. 4. A warning device sound before countershock, so there is time to move away. The correct answer is 4. An implanted defibrillator always provides at least 3 beeps before delivering a countershock, and the nurse should tell the spouse to move away when they hear those beeps. The spouse can have physical contact with the client, but if the ICD were to discharge while the spouse had contact with the client, the spouse would feel the shock and could also be harmed. The spouse will feel the countershock if touching the client, and it would harm the spouse. During physical assessment, the nurse should further assess the client for signs of atrial fibrillation when palpation of the radial pulse reveals 1. 2 regular beats followed by 1 irregular beat. 2. An irregular rhythm with pulse rate greater than 100. 3. Pulse rate below 60 beats per minute. 4. A weak, thready pulse. The correct answer is 2. Characteristics of atrial fibrillation include pulse rate greater than 100 beats per minute, totally irregular rhythm, and no definite P waves on the ECG. During assessment, the nurse is likely to note the irregular rate and should report it to the physician. A weak, thready pulse is characteristic of a client in shock. 2 regular beats followed by an irregular beat may indicate a premature ventricular contraction.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.